On the forefront of dentistry are techniques that incorporate the idea of physiologic-based dentistry, where the teeth, bones, muscles, and joints all work together in harmony. Dr. Andrew Willoughby and a partnership with the Las Vegas Institute are innovators in this neuromuscular approach. They're using state-of-the-art technology to analyze and restore the patient's dental health.
Neuromuscular dentistry is much more than just a dental philosophy. It's a series of clinical protocols and systems that we use to help the patient build an optimal or physiologic bite. In order to achieve that optimal bite, we need to have all of the muscles in the head and neck in a relaxed, posturally correct position. The position of the head and neck influences the airway. That's the second thing that we need. We need to have a competent, patent airway. Third thing, we need to have the jaw joints in their anatomically correct position. We also need a bite that is bilaterally even. And finally, we need all of the muscles that are responsible for jaw opening and closing, the muscles of mastication, they need to be relaxed in order to verify that that optimal bite has been met and that it is stable and comfortable for the patient. We use some sophisticated digital equipment, jaw tracking devices, to measure and refine that bite.
Imaging and other technology is helping drive diagnosis and treatment.
From the CT scan, we know what bone's available, we know all the anatomy that we kind of guessed at before. We always had to make an incision, reflect the tissue, find out what was there to work with. And now today, with the CT technology and then the treatment planning software, those are the two key components to knowing what you're getting into before you start. So you can basically build a house before you place the implants, is the whole concept. If we can balance the teeth, the muscles, and the joints, using the data there, it's more of an objective way to rebuild or build the patient's dentition.
Problems with your mouth can cause multiple health conditions.
When your muscles of your jaw are not in harmony or relaxed or in their physiologic position, it affects the position of the head. And that position of the head will affect the neck and the muscles of the neck and the shoulders, as well as the muscles of the head. So somebody can be in chronic pain with even migraines, and it's bite related. And the same thing with sleep apnea. Somebody, because their bite is off, your jaw's pulled back, their throat closes and they actually can't breathe at night.
The benefits of this type of dentistry for the patient are that it can help resolve temporomandibular joint issues. It can help eliminate common daily tension headaches and migraines. By positioning the teeth in an optimal bite position, you have improved form and improved function, long-lasting, durable aesthetics.
Dr. Willoughby discusses his patient who requires an extensive reconstruction.
He has a severely mutilated, broken down bite. He has no posterior occlusion, so when he comes together, he kind of dances around and can't bring his teeth together properly. He also has all the signs and symptoms of temporomandibular joint dysfunction. His lower jaw is retruded because he has no posterior bite. So he suffers from clicking and popping when he opens and closes. He suffers from daily headaches and neck pain. And these are all classic signs and symptoms for a patient that has a broken down or mutilated occlusion. In this particular patient, we need to reconstruct and place teeth where he currently doesn't have any. So the uniqueness of this approach is that we're not only surgically placing the dental implants, but we are screwing down the little abutments and placing teeth on top of them at the very same appointment. It's being done immediately after the implant placement. And the only way that you can do this is when you've optimized the bite and ensured that all of the muscles where he is applying the biting forces are evenly distributed so that you are not overloading the dental implants.
Physiologic-based dentistry is about finding the position where the muscles are supposed to be, where the muscles are in their completely physiologic working position. Rather than trying to manipulate the jaw into a position where it looks like it should be, the muscles will find the position where they need to be. And that's when we talk about physiologic-based dentistry, that's what we're referring to.
Using these methods, the implants should be very long-lasting.
Dentists are really mechanics at the end of the day. And the more objective data that we can gather before we rebuild somebody, the more likely it's going to be a long-term restoration for that patient. An implant today placed with the right approach, built with the proper biomechanics so that the patient doesn't overload the implant, mechanically they should last a lifetime. So if my expectation is when I place an implant today, unless something happens to that patient that's violent, they should have that implant the rest of their life. I don't think with today's technology that we have to accept bone loss and tissue loss and breakdown of the structure. It should be a lifelong restoration.
Coming next, more innovations in the field of dentistry, healing nanotechnology. We continue with Dr. Andrew Willoughby, who reveals the newest developments to help his patients get their teeth and mouth back into balance. He discusses a high-tech material which assists in healing and decreases pain for the patient.
In this procedure, we're using a new FDA-cleared nanometallic silver sol product. It's a wound healing, anti-inflammatory, disinfectant product that provides the patient with superior wound healing capabilities. They experience less pain post-operatively, and throughout the procedure, we're using either a liquid form or a gel form of this product. Now, I've literally done thousands of periosseous surgeries with these products, and I can tell you emphatically that this product helps the patient experience less post-operative pain, helps them heal more quickly. It just produces a better clinical result.
On the patient, which they're working on today, they're using the Silverstat gel. That gel is FDA cleared to do a number of things. It can help heal like diabetic ulcers. It can do grafted sites, device insertion sites. Most of the old people stuff where they get wounds that won't heal. This product is designed, it's a gel, and it's designed to help heal those wounds. Today in the procedures that they're doing downstairs, what they're actually doing is they're using it as an antimicrobial, meaning that it kills bacteria. It will protect the patient so that there are no secondary infections. It also helps reduce the inflammation, which means that the patient has much less pain. At the same time, the healing factors are elevated, which means basically that they're going to heal about twice as fast.
Another thing that we find with the Silversol products is we can combine it with Botox, and it extends the useful life of the muscle relaxation effect. We're injecting it into the masseter muscles to try and help this patient prevent him from clenching and grinding. He still has a deviated septum, and until that surgery takes place to correct it, we don't want that patient clenching and grinding and putting and exerting excessive forces on the implants and the crowns that were placed on the implants.
Developments in science will continue to provide new techniques for your dental health.
I think 5 years from now, we all think we're there and there's not much else to learn, but every year we're wrong. There's more and more data, more and more objective data that helps us be better at what we do. So I think 5 years from now, the tools will change somewhat, but not dramatically. I think the science in bone healing and bone growth, and I think we're not too far away from actually implanting a tooth bud that will replace a missing tooth. But until that happens, the implant's the best we got.
The most satisfying thing for me in providing all of these innovations and new clinical techniques to patients is after I'm done, when I hand them that mirror and they look for the first time at their new smile and the way I've reconstructed their bite, there's a lot of emotion. I often see patients with tears welling up. It means a lot to me.